Hi, my name is Joseph Wu. I'm at Stanford University, and I'm the immediate past president of the American Heart Association. We are here at our annual scientific sessions in Chicago, and I'm here with my esteemed guest, Dr. Dhruv Kazi.
Hi everyone, I'm Dhruv Kazi. I'm a cardiologist, outcomes researcher, and health economist at Beth Israel Deaconess and Harvard Medical School in Boston. Excited to be here.
Thank you, Kazi, for being here. And we're talking about this International Symposium that we have this year. It's actually the very first year that we're hosting this important event. And I want to ask Kazi about the impetus for setting up this International Symposium, why it's important for the AHA to do this.
Yeah, thank you, Joe. It's really exciting to be here at Sessions, which is our first sessions of the second century of the AHA. And what the audience may not always realize is that although we are called the American Heart Association, from the very beginning, a major focus of the association has been international work. So the America in American Heart Association was meant to include North and South America. Even today, we have extensive international collaborations in over 100 countries, ranging from developing new science, training physicians, maintaining and measuring quality of care, and then advocacy, like pushing for equitable access to care across the world. And our goal with creating this international symposium is the first that we've ever had accompanying the scientific sessions, is to highlight both the deep and broad network of international collaborators we have at the American Heart Association.
Mm-hmm. Thank you, Kazi. And are you involved in some of these international partnerships and collaborations in your own research?
Yeah, and thank you. I am, as you know, I co-chair AHA's International Committee, and so through that I help supervise and many of these collaborations across the world, but also in my own work, I do outcomes research and health economics research, where we've examined a range of questions as they're relevant to both the US, but also low and middle income countries, and increasingly in Latin America. As you know, cardiovascular disease is now a global disease. It is not restricted to high income countries. And so understanding how we can get equitable access to affordable therapies worldwide is a priority for everyone.
Great. And what are some of the challenges that you foresee in terms of setting up these international partnerships?
Yeah, you know, the way we're thinking about these international partnerships are at the American Heart Association is thinking about them in terms of knowledge generation, knowledge dissemination, quality measurement, and advocacy. Those are the four pillars of our international work. And so in knowledge generation, as you're actively involved with research collaborations around the world, our goal is to bring collaborators who are doing work in with partners around the world, you know, including folks who are working, for instance, in rheumatic heart disease in Africa, or cardiometabolic conditions in Asia, and in particular the Middle East, which is a big priority area for the American Heart Association, and increasingly in Latin America, to bring them together and talk about what it takes to generate country-specific research. So we believe in reciprocal partnerships, reciprocal learning, and so if it's not the idea that we generate the information and disseminate it as much as it is what can we learn together from each other's experiences.
I think the reciprocal partnership aspect is very important because, you know, based on my own experience of collaborating with many of my international partners, I actually learn as much from them as they do from me. And some of the questions that they're posing to me, I've actually never thought about until I started working with them. So, you know, it's you know, I think the information, I think the knowledge is a two-way street, and this is why it's so important to set this up. And so, Kazi, tell us more about the agenda that we have for today. It's I look at it, it's a very exciting agenda. So tell us, give us some highlights.
One of the things I want to emphasize is that the AHA sees its role as a catalyst in these international collaborations. The metaphor that comes to mind is like an escalator. A lot of our low and middle income country partners, they have some of the resources, they have the wealth of knowledge, they have the disease burden, but if you can help them get onto the escalator, now suddenly they're generating their own knowledge, they're able to disseminate and improve quality of care within their own context, and that's the role that the AHA would like to play. So the way the symposium today is structured is in three parts. The first part primarily focuses on what are the AHA's priorities, and how do we deepen the network of AHA research collaborations? Now, you know that there's some fantastic research happening around the world, but cardiovascular trials and cardiovascular studies are best done when many countries, many people come together to work on this research. And so we're going to learn from some of the folks who are doing it very successfully, like Dr. Prabhakaran and others, on how do we build international research collaborations. In the second session, we're going to talk about quality of care. How does one measure quality? How does one build in-country registries to measure quality of cardiovascular care and improve outcomes? As you know, the AHA had a very successful initiative in East and Southeast Asia. And so what have we learned from that initiative? What can we extrapolate to other contexts? And then the third session is a more general session on what is AHA's role in addressing the healthcare needs of our partner countries. What can we do for high quality advocacy? And we're going to highlight some of the programs that the AHA has been leading worldwide. So really exciting half day starting at 12:30 in Chicago.
Wow. Well, thank you so much, Kazi, and thank you for your leadership. And as Kazi mentioned, you could tell by his enthusiasm. This, likewise for me, this is one of the most exciting new sessions that we're going to have at the AHA, and I look forward to seeing many of our international and domestic colleagues there. Trust me, I think you will come away from the meeting, from this symposium, with fresh ideas and new collaborations with our partners. And I look forward to seeing all of you at the International Symposium.